Hello, my name is Cara. I'll be the intern doing these examinations on you today. I'm going to start by washing my hands. Alright, and then we'll go ahead and get started. So I'm going to go ahead and occlude one of your nostrils. I'm going to have you breathe in. I'm going to occlude the other one. Breathe in. Good. Patient's a little congested but symmetrical between the two nostrils. This time I'm going to have you close your eyes. And I'm going to occlude a nostril again. And do you smell anything this time?
Yes.
What do you smell? Good. And then I'm going to occlude your other nostril. And do you smell anything?
Yes, toothpaste.
Good. Both of those were correct. This time I'm going to touch your face for a second. And I'm going to have you clench your jaw, relax. Clench your jaw, relax. So that was symmetrical between shape and size. And for the next one, I'm going to come close to your eyes. So I'm going to have you look up and away that way. Good. Look up and the other way. Over here. Perfect. Blinking, observe, symmetrical response for both. And then I'm going to use your hand for a second. This is going to be our stimulus here. Can you feel that?
Mm-hmm.
Good. So I'm going to touch various parts of your face and just let me know when you can feel it by saying now. I'll have you go ahead and close your eyes.
Now. 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 Now.
And did that feel the same on both sides?
Yes.
Perfect. So symmetrical between the sides of the face. And we're going to do the same thing but with different stimulus this time. So this is going to be the dull stimulus and this is the sharp stimulus. Can you feel the difference between the two?
Yes.
Go ahead and close your eyes. I'm going to touch your face again with the stimulus. Let me know if it's the sharp or the dull.
Dull. Sharp. 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 Dull. Sharp. Sharp. Sharp.
And did that feel the same between both sides?
Yes.
Perfect. Now we're going to go through a series of facial expressions. So I'm going to have you raise your eyebrows, and forehead lines are observed and symmetrical. I'm going to have you frown, vertical lines observed and symmetrical. And then I'm going to have you close your eyes as tight as you can and try to resist me pulling them open. And it's symmetrical in resistance between both eyes. And then I'm going to have you smile. And nasolabial folds are present and symmetric. Show me your top teeth. Show me your bottom teeth. And that is symmetric as well. And then I'm going to have you puff up your cheeks, both sides. And I'm going to touch each side and try to resist my touch. And both of those were symmetrical in size and strength. Now we're going to evaluate your hearing. So I'm going to close one of your ears. And I'm going to whisper a word to you. Let me know what you hear.
Numbers.
Good. I'm going to close your other ear.
Numbness.
Good. And both were at arm's length, same distance on each ear, and words were correct. And now I'm going to place this on your forehead. And do you hear a sound?
Yes.
Is it the same on both ears?
Yes.
Same loudness?
Yes.
Okay. And one more. I'm going to come over to this ear, behind it. Do you hear that?
Yes.
Let me know when you don't hear it anymore.
Now.
Do you hear it?
Yes.
Good. I'm going to do the other ear. Do you hear it?
Yes.
Let me know when you don't.
I don't.
Do you hear it?
Yes.
Good. Symmetrical on both sides. Next, we're going to check your voice quality. Can you state your name and where you're from?
Liliana Gonzalez, and I'm from Florida.
Have you noticed any changes in your voice lately?
Nope, none.
Can you go ahead and swallow for me? Any difficulty with that?
Nope, none.
All right, and the voice is not hoarse or nasally. Next, we're going to take a look at the inside of your mouth. I'll have you open your mouth wide, say ah. I'm going to stick this here. Good. And the soft palate rose symmetrically. The uvea did not deviate, and both sides of the posterior pharynx moved medially. Next, we're going to check your gag reflex. Have you open your mouth again? and gag reflex was symmetrical on both sides. Next, we're going to take a look at your muscles. So first is the trapezius muscle. So I'm going to press down on your shoulders here. I'll have you shrug your shoulders as hard as you can. Very good. It was symmetrical in strength and contraction for the trapezius muscle. Next, we're going to look at the sternomastoid. So I'm going to put my hand here, and I'm going to have you lean into my hand. And there's the contraction of the sternomastoid. And then we're going to do the other side, lean into that hand. There's the contraction of the sternomastoid, symmetrical in contraction and strength. Next, we're going to look again at your mouth. So I'll have you open your mouth wide. And the tongue fits in the oral cavity. There's no fasciculations. I'm going to have you stick your tongue out as far as you can. Is that as far as it goes? All right, and it does not deviate. Now move your tongue side to side. And that's symmetrical. And then I'll have you put your tongue up against your cheek. Good. And I'm going to press down or press your cheek here. Do the other side. And that was symmetrical and strength for the tongue there. Next, we're going to take a look at your sense of touch, and I'm going to go ahead and show you what the stimulus will feel like. So I'm going to take your hand here. Are you able to feel that?
Yes.
Okay. And then I'll have you take both hands, go palm up, go ahead and close your eyes. And I'll have you say now whenever you can feel the stimulus I just showed you on any part of your body.
Now. 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 Now.
Did that feel symmetrical or the same on each side of your body?
Yes.
All right. And then we're going to do the same idea, but we're going to have different stimulus this time. So I'm going to take your hand again, and here's going to be the dual stimulus.
Mhm.
Here's the sharp stimulus.
Mhm.
Are you able to feel the difference between the two?
Yeah.
Okay. Go ahead and go palms up again. Close your eyes again, and then let me know which stimulus you feel anywhere in your body.
Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sharp. 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 Dull. Sorry.
Mm-hmm.
Sharp. 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 Dull. Sharp. 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 Dull. Sharp. Dull. Sharp.
Did that feel the same on both sides of your body?
Yes.
All right. I'm going to have you keep your hands like that, and then keep your eyes closed. And I'm going to put something in one of your hands. I want you to just feel around at the object and try to figure out what it is without looking at it. Here it is.
This is a ring.
Very good. We're going to do your other hand. Try to figure out what this object is without looking.
This is a key.
Good. Both of those were correct. All right. And then stay like that with your eyes closed and your palms out. I'm going to draw a number on the palm of your hand. Try to tell me what it is.
7.
Good.
8.
Very good. Both of those were correct. Both of those last two tests indicate an intact sensory cortex. Now we're going to test your motor system. So first, I'm just going to have you walk to the end of the room there, just as you normally would, with your head up, looking straight ahead. And I'm just going to spot you, so go ahead. And then I'll have you turn around and walk back. Okay. And then for this next one, same thing with your head up, looking straight ahead, but we're gonna walk with heel to toe. Does that make sense?
Yes.
Okay. Good. Everything looked balanced there, no unsteadiness, and everything looks balanced. And then for this next one, I'm gonna have you walk to the end of the room, just on your tippy toes. And then when you walk back to the chair, walk back on your heels.
Okay.
And remember to keep your head up the whole time.
Okay.
Good. And then to the heels.
Yep.
Very good. Everything looked balanced, no unsteadiness. And then for this next part, I'm gonna have you stand on one leg, and then with this knee, you're gonna bend down slightly. Good. And then we're gonna switch to the other leg and do the same thing here. Yep. Look symmetrical with no obvious dominance. All right, so for this next part, I'm gonna have you just stand with your feet together, and you're gonna keep your eyes open, just look straight ahead. And I'm just gonna have you stand as still as you can for 20 seconds. So we're gonna go ahead and start. Good. All right. And then next, still with your feet together and looking straight ahead, we're going to close your eyes this time. And we're going to try to stand still with your eyes closed for 20 seconds. So here we go. All right, perfect. So patient was able to maintain an upright position, not swaying within either of the 20 seconds. And then for this next one, as you are, you'll just put your arms out, palms face up, and we're gonna do another 20 seconds just with your eyes closed again. So go ahead and close your eyes and try to maintain this position for 20 seconds. All right, perfect. Keep your eyes closed, keep your arms how they are. I'm gonna press down on your arms and try to resist me pressing your arms down. All right, perfect. So the patient was able to keep their arms in a steady position for the entire 20 seconds, and they were able to bring their arms back to the original position once I tried to push them down. All right, so I'm just gonna take your hand here, and are you able to squeeze my fingers?
Yes.
Good. And then I'm going to look at your other hand here. Are you able to squeeze my fingers again?
Yes.
Good. So patient response showed no dominance of hands and was symmetrical in strength. Next, I'm going to test the strength of your wrist. So go ahead and put your arm out. I'm going to grab your wrist and make a fist with your hand. Try to resist as I push your wrist downward and as I push it up. Good. And we'll switch to this one. Make a fist again. Resist as I push down and as I push up. Good. So symmetrical strength of the wrist with no dominance noted. All right, so next I'm just gonna have you take your pointer finger and touch the first joint of your thumb and then tap them together as quick as you can. We're gonna do that for just a second with this hand. And then we'll switch to your other hand. Same thing, good. All right, perfect. So no dominance noted, symmetrical in strength, rhythm, and smoothness. And then for this next one, I'm gonna have you take the palm of your hand and slap down on the top of your leg here. Go as fast as you can. And then when I say now, I'll have you switch to alternate like this. Make sense?
Mm-hmm.
Okay. Go ahead and switch. Good. And then we'll switch to your other hand. Same thing. And go ahead and switch. Perfect. All right. Smooth transition, alternating, no dominance noted, symmetrical strength, rhythm, and smoothness between the hands. All right, so for this next one, I'm gonna place my index finger here. I'm gonna have you use your index finger to alternate between touching your nose and my fingers. Go ahead and try that. And do that as fast as you can. Good job. And go ahead and keep doing the same thing as I move my finger. Good, my finger's back in the middle, so I'm gonna have you close your eyes and do the same thing. Good. Then we'll switch to your other hand. And we'll start just in the middle again. And then I'm going to move my finger again. And we're back in the middle again, so I'm going to have you close your eyes. Very good. All right, so patient was able to perform and it was symmetrical between both of the hands. For this next one, I'm going to put my hand on your leg and I'm going to have you try to bend your knee. And I'm going to have you try to straighten your knee. Good. Try to bend your knee. Try to straighten your knee. Okay. Symmetrical and strength between the two, no dominance noted. For the next one, I'm going to put my hand under your foot and try to tap my hand with the ball of your foot as fast as you can. Now let's do the other one as fast as you can. Good. And it was symmetrical between the 2 feet. Okay, so for this next one, I'm going to have you take the heel of this foot and touch your knee on that leg. And then you're going to use your heel to slide all the way to your big toe. And then we're going to do the other leg. Then go ahead and close your eyes and do the same thing. Good. Symmetrical response, no dominance noted. Now we're going to be testing your reflexes. So we're going to start with your bicep reflex. So I'm going to take your arm here and I'm going to have you clench your teeth and look away from me. Good. Reflex was present. Look away, clench your teeth. And reflex was present and symmetrical on both arms. Next, we're going to look at your tricep reflex. I'm going to take your arm and put all your weight into my hand here. And look away, clench your teeth. Reflex is present. Let's do this arm. Look away and clench your teeth. Reflex was present and symmetrical between the arms. Now we're going to take a look at your brachioradialis reflex. I'll have you put your hands like this and clench your teeth and look away. Reflex is present, switch hands. Clench your teeth, look away. Reflex is present and symmetric. Now we're going to look at the patellar reflex. I'll have you grasp your hands like this, pull hard, and look away. Reflex is present. Reflex is present. And keep holding your hands like that and grasping them hard and looking away. This is the Achilles reflex. I'm going to put my hand under your foot. Leave the weight of your foot on my hand. Reflex is present. Same thing, keep looking away. Reflex is present and symmetric.